lived experience through giving birth. And I also had a loved one that passed away after giving birth. And so coming together and joining forces with so many other women and hearing their stories let me know that I wasn't alone and that this work is that much more needed. I would say my experience has been overwhelmingly great, but I use the word overwhelming because it's still a lived experience. It's sharing my own story that I experienced, as well as listening and being of support as others share their stories. And some of these stories are very, very heart-wrenching. And so my experience has been fueled with excitement and encouragement that the work continues, but also empathy, care, and compassion that so many people have had to have these experiences for this work to even be relevant.
So I think between the 3 phases, I'm really glad that we decided to do it in 3 phases. Thinking about the first phase and using the Community Advisory Board, 100% Black women and lived experience to really shape what good things were going on, what we call them like protective factors, and some of the drivers, because we were able to then, in the second phase, developing the strategic plan, really be specific and hone in on how we can make a difference. I think a lot of times we think about solutions first, well-intended, like a solution comes along that sounds really positive and that could be really helpful, but without the detail, I think that we're able to get, sometimes it falls through. So looking forward to just supporting the specific things that were mentioned by the Community Advisory Board. First work group that's focusing on anti-racism and discrimination training, not only for doctors and physicians, but also for staff, for support staff, anyone who connects with the family. So being able to do that specifically, and excited about some legislation that was passed that's able to support that. The work group 3 in establishing birth worker training and increasing the number of Black birth workers is super exciting. Lactation consultants and full spectrum doulas. I think it's important to have individuals in the community that already have relationships and trust to make it a little bit easier to have access to some of the support. And the third work group, again, I think being the most important piece of really just keeping this community centered. So how do we continue to have the Community Advisory Board and the Community Health Improvement Plan Committee to see this plan through and not stop there and continue on after year 5 to look at some of the metrics to see how well we're doing, what things can be tweaked, and what are some other things maybe that we didn't think about. We could always use more individuals, more people participating in the work group. If you're interested in joining the work groups, you can visit the Frederick County Health Department's website, Black Maternal Health Focus. There are 3 different work groups. The first one is anti-racism and discrimination training. The second one is increasing Black birth workers. And the third one is really just keeping the community centered in all of this work that we're doing. Even if you feel that you may not know where to start, know what you can contribute, the more people we have involved, the better we can support the community.
Developing a plan of action, and that plan of action, being able to take that to leadership within Frederick County to say that these are the stigmas that exist, and this is the data that shows it, and this is a plan on how the Community Advisory Board has decided that it's the best course of action to implement a resolution for the systemic issues that are happening. So my experience with the Black Maternal Health Initiative has been nothing but positive. And I think just the sisterhood, and we're all striving for a common goal, and that's to deal with the systemic issues that are happening in Frederick County.
So I think phases 1 and 2 have just been a lot of discovery, some research, and a lot of discussion. And what I'm excited about seeing in the years to come with this initiative is how the maternal health outcomes improve over the years. I think we're going to be able to put a lot of practices and processes into place that will help support our community. And I'm just really excited to see how we can just kind of shift some of the statistics and just bring more awareness to our health. I hope to see more women hiring doulas during phase 3 and beyond. Women in the community coming together to support this initiative has been a major accomplishment as well. Just for us all to be on the same page, for us all to share an experience, and for us all to be pushing for change for the future.
I've been involved in public health since about 2015, and the statistics have been exactly the same for at least 10 years that I've been in the field. And so actually acting on those statistics, remembering that data points are people, these are human lives, I think showing that we are actually taking action, that we're making the commitment to really addressing the issues that, quite frankly, have only been paid lip service to in the past. We have the commitment we've seen by actually centering the voices of Black mothers that we get more done. We know the substance, we know the lived experience, we understand what the impact of the issues are that we currently face, but then we also understand what the impact will be of resolving those issues.
As a community member in Frederick County, as a mother, as a Black woman, the main difference that I've seen is I've learned that I'm not alone in my thoughts. I'm not alone in my feelings. I'm not alone with my experience in giving birth to 2 girls in Frederick County. And it has given me the opportunity to work with others that want to amplify and understand that there can be cultural competency with our experiences as Black women. So with those solution-based conversations comes action, and with the action comes people that are able to feel a resolve and able to feel satisfied and able to feel heard and able to feel as though they are accomplishing many goals. And that goal is that Black women are not dying in childbirth at fast speeds, but they are being taken care of and they are being taken serious. It's really important to allow the community to have the opportunity to work with us and to understand that no matter the demographic, no matter the pay scale that you may be on, the tax bracket that you may be in, that you are important and that your experience as a mother is important.
I am Catherine Dorsey. I am a member of the CHIP committee. And one of the reasons that I joined the CHIP committee as a Black mom, of course, having 2 children, having lost a child, I thought it was important to make sure that my experiences are out there in order to make sure that other women didn't get a chance to doesn't have to go through some of the things that I went through. And so one of the things that I really like about the CHIP committee and even the CAB committee was that it really centered Black voices. It was really important to make sure that Black voices were heard. You know, when they're doing interviews or when they're doing surveys, it's really going out to the women who have these lived experiences. And I thought that that was really important. So I really did feel like by being a part of this process, the Black woman's voice was centered throughout it, and that we were being heard throughout it, and our concerns were being validated. And even when there were other people in the space who might not be Black, who still have valid opinions, they still made sure to turn to us as the experts on the matter, because we are the people that are being affected by this. And so that was one of the things that I really enjoyed about being part of this process. I've been a part of a lot of different groups, and a lot of the times you go through this assessment period and then that's kind of the end of it. We're always like, well, what happens after the assessment period? What are the solutions that are being brought after that assessment period? And so we really had an opportunity to be kind of part of both sides.
A lot of the time within the healthcare system and with organizations in general, they say they are trying to do work and things like that, and it doesn't really, the passion isn't really there. But with the people here, I can tell that the passion is here, and they are really advocating for Black women. Black people and Black women here have a voice, and that's something I'm very, very proud to be a part of, because in so many other aspects of life and so many aspects of just being a Black woman, your voice is taken away and you're not really being heard. But within this organization, you feel proud to be a Black woman and you feel proud to help Black women. And I think that's such a beautiful thing.